Hello, my name is Sophia, and I'm going to be giving you a shift report for our patient, Mr. Johnson. So, Mr. Johnson is a 67-year-old male, and he was admitted to the ER this morning for an ischemic stroke with the left-sided stroke. So, he has been experiencing right-sided weakness in his arm and leg. And so, I'm just going to give you an update for when he's getting transferred to the med-surg unit. He was earlier this morning was in ICU, but his symptoms have subsided. So with the neuro assessment, we have been doing NIHSS exams every hour on him, and we have noticed that his initial facial drooping from this morning has resolved, but he still has some weakness on his right side in his arm and his leg, and his oxygen has been maintained at 96%, and he's currently on a nasal cannula of 2 liters. And so from the doctor's orders, we want to make sure that we're assessing his airway, breathing, and circulation and maintaining the O2 sat over 94%, but it looks like that he's doing pretty well. And one of the things that I've been monitoring him throughout the last shift is deep breathing exercises and making sure that he's using the incentive spirometer properly. And I've been doing assessing lung sounds, and it looks like his lungs are starting to clear up and they're not as shallow as they were this morning from the diagnosis of the ischemic stroke. And then cardiovascular system. So he is currently on a heart monitor right now, which his blood pressure was reported to be 172/88, which is a little bit high, but we want to make sure that that he's getting perfusion to his brain and that his heart is still pumping oxygenated blood around the body. So it's okay if it's a little bit high. From the doctor's orders, he wanted us to maintain a blood pressure around 108 to 105 for the first 24 hours, and it's going to be individualized depending on the range, of course. And for this for this patient, we have been giving him Alteplase IV, and we were making sure that each hour we have been recording the vital signs and neuro status for him for the first 24 hours, and making sure that he's not given any anticoagulants or antithrombin agents for this patient, of course. And with Mr. Johnston now moving on to GI system. So his last bowel movement was 2 hours ago, and he's been having adequate urine output. We've been making sure that that he's been getting fed consistently, and I have noticed that he hasn't had to have a ton of assistance with feeding as well. And we've been making sure to help him get up to the bathroom and walk around a little bit, so he's still staying mobile. Even though he had the stroke, we still want to make sure that he's maintaining activity and not getting stasis in his extremities. And for his musculoskeletal system, he was able to get mobile very early after the accident of the stroke over the past few days, and we've been doing ROM exercises with him every 4 to 6 hours. We are continuing collaborating with the physical therapist and occupational therapist because he still seems to be having some speech difficulties as well as a little bit of slurred speech. So making sure to enunciate your words and speaking clearly, but not yelling or being loud at him, just so that we're able to communicate one-on-one with him and still get his care as needed. And for skin integrity, he has been doing good. He hasn't had any major pressure ulcers because, again, as I mentioned, he's been pretty mobile and up and at him and moving pretty well. We have been making sure to change his position every 4 hours and assessing his skin as well so that he doesn't get those pressure ulcers. And we've been putting his bed up to at least 30 degrees so that he doesn't aspirate on any of his food contents, and so that he can have a better lung expansion to breathe as well. And just so that you know, before I pass this patient off to you, I did chart the vital signs. So his vitals that was called was a temperature of 99.9, degrees Fahrenheit, a pulse of 108, respirations of 20, blood pressure of 140 over 105, and O2 of 97% O2 sat, and he's still on the 2 liters of nasal cannula, so he is doing well with his oxygenation, and he is not in isolation precautions. The last time I did a pain assessment was 2 hours ago, and he said that he wasn't on any major pain medications or any NSAIDs when he was at home. And from after the stroke, doing regular pain assessments, he said that he was a 2 out of 10, so he's doing pretty well. And then we were making sure that his eyes and nose have been good, and they've been regular throughout the shift, and he's not on any fluid restrictions or diet restraints. And then making sure that we're assessing the IV site, because he did get Alteplase, and that was discussed with the doctor for him as well. So we've been assessing that every 2 to 4 hours as well, and there's no phlebitis or redness or edema at the swelling site, which I checked last hour ago, so I documented that as well. And then some of the things that we've been trying to reinforce and teach him is making sure that he's properly hydrated during this time, because a stroke is a pretty big event. So we've been making sure that water is maintained at his bedside at all times for him. We've also been making sure that that if he was experiencing any speech slurs or anything, that we have come up with different communication skills, whether it's pictures or drawing out words. And I've been using an erase board with him to help with writing out different things. And we've been doing different exercises with him, which his wife and family have been really good. So doing different puzzles or doing matching picture games to help like reignite that area of the brain that was damaged, because he did have a left-sided stroke, so the right side of his brain is gonna still be trying to recover from that. And then lastly, he's not on a Foley or a catheter, so there's nothing to worry about there. And so those are all the reports that I was going to give you for this handoff.